Hello, everyone, and welcome to our relationship and fertility event. My name is Monica Pereira, and I am the marketing specialist at Inception. Before we get started, a quick overview of our Zoom platform. So you can ask the questions at the bottom, where you will see a little Q&A box that has two little quotation icons. And so if you have any questions there, you can enter them throughout the event and we will answer them near the end of the event for the Q&A portion. And now that we've taken care of those logistics, I want to introduce our wonderful speaker for tonight. We have our renowned fertility psychologist, excuse me, and Inception's Chief Compassion Officer, Dr. Ali Domar.
Thank you so much, Monica. You know, if I was a physician, I get paid more, so I'll stick with being a psychologist. So can I have the first slide, please? Haven't seen it yet. So while Monica's looking for the slides, which I could swear I sent to her, as she said, you know, this is actually, my presentation is relatively short. I know we have an hour booked. Oh, there we go. I know we have an hour booked, but I say this every time I give a talk, that I grade how I do by how many questions I get asked. So I think she just told you how to do the Q&A, but it's going to be a relatively short talk. And then I would really like to answer your questions, because every relationship is different. And I don't want to assume that what the presentation I'm about to give you is going to relate to you. So if there's anything that I missed or was confusing, or you just want to ask me, please do. These are anonymous. I won't know your name. No one will know your name. So we're going to talk about relationships. And the reason we're doing this tonight is tomorrow's Valentine's Day. And Valentine's Day is a very special holiday for people going through infertility, because it's the only holiday in the year that has nothing to do with children. It's not about toys or Easter baskets or, you know, 4th of July fireworks with their family. It's really about love. And it's about, you know, not just if you have a partner, loving your family. I often send Valentines to all my friends, to my sister. I didn't do it this year because my dog died last week. And so I've been in a bit of a funk. But I often, you know, I think Valentine's Day is a really special day. And as I said, for people going through infertility, it can be a really special day. So I'm hoping that what I talk about tonight can be helpful for you, not just for tomorrow, but as you go on this challenging journey. So, you know, I'm a psychologist. I have a private practice 1 day a week in Boston. And then 4 days a week, I work at Inception as their Chief Compassion Officer, and I'm their Director of Research. So next slide, please, Monica. So, you know, as I said before, I do a lot of couples counseling, and I have for a very long time. And couples who come to see me, or individuals who come to see me who are dealing with infertility and the impact on their relationship, often ask me, why is it so hard as a couple to deal with infertility? And to be very honest, I've probably, seen hundreds and hundreds and hundreds of couples as they've gone through infertility, and I have never seen two members of a couple be in the same place at the same time. Whether it's a heterosexual couple, a gay couple, a lesbian couple, a trans couple, it doesn't matter. I've just never seen two people in the same place at the same time. And so the person who wants to move forward faster says to me, you know, my partner is holding me back from having a baby. And the partner says, well, you're pushing me to make decisions I'm not ready to make. And so that's sort of how they come in when they come to talk to me. And often one member of the couple wants to talk about infertility more than the other. Traditionally, it's the woman, if it's a heterosexual couple, it's a woman who wants to talk about the infertility a lot more than a man. You know, men tend to be more problem solving. And, you know, it's like, okay, so you got your period, we're going to call the doctor and make a plan. Where for the female member of the couple, getting her period might very well feel catastrophic, and she wants to talk about it and process it. And just making a plan with the doctor just doesn't cut it. And so what you often hear from a couple is one of them will say, you know, we never get a chance to talk about our infertility. And the other person will say, oh my God, that's all we ever talk about. And if this feels familiar to you, and this is why I'm giving examples like this, if this feels familiar to you, it means you're normal. It means that you are experiencing infertility the way many, many, many people do. So next slide, please. So for those of you who heard me speak before, you know that I talk a lot about the impact of infertility on every aspect of your life. And I'll give some details. It affects your relationship, it affects your sex life, it affects your relationship with your family and your friends, it affects your job. I'm actually giving a talk in a couple of weeks in the UK on fertility and your job, because it does impact your job. In most states in this country where there's no insurance coverage, it affects your financial security. It can affect your relationship with God, and it can affect your body image, your self-esteem. Next slide, please. So be aware, and this is really important to remember, that if one of you has a diagnosis, whether it's male factor or female factor, whoever has a diagnosis, the whole infertility process is going to have a really different meaning. So if it's a female factor in a heterosexual couple, if it's a female factor, it's going to affect her more perhaps than it will him, not just because the infertility physically affects her, but the physical reason is because of her subfertility. And the same thing goes for men. I mean, if you look at the data, which I'll talk about in a little while, men tend to express less distress through the infertility process unless the diagnosis is male factor. And if the diagnosis is male factor, it can hit men really hard. As I said, I've seen couples, I've seen men, I've run groups for men, and men tend to be more stoic. They don't tend to want to talk about it. But if you look at the research in terms of how men actually describe their symptoms, most men, as part of an infertile couple, the majority have psychiatric levels of anxiety, and at least a third of them report psychiatric levels of depression. So even though men may seem more stoic, when you talk to these men alone, they'll say, I'm feeling just as bad as my wife, but I feel one of us has to stay strong. Like if both of us fall apart, what's going to happen? And so they feel that they have to be strong for their partner, even though inside they may be crying. Next slide, please. So things that you need to think about if you are part of a couple going through infertility for a lot. And I was actually I did a podcast yesterday, and I was trying to explain to the person the host of the podcast, what it's like for a couple going through infertility. And for a lot of people, this is the first crisis they've ever been through. And it's really scary. If you love this person, then you're happy and you want to build a family. And it can feel really uncomfortable that for your first crisis, that you and your partner aren't coping in the same way. And if you feel like, well, this is how I feel, and that means that's how that person should feel. And things that you need to think about is if there is a diagnosis, who has the diagnosis matters. Who is undergoing treatment matters. I mean, physical treatment. Is the woman taking, she having shots and procedures and surgery and taking medications, or is the man having surgery and taking medications? If in a couple, who spends more time researching infertility? It can be both of you. It tends to be the woman, but who is spending more time online? There's one study that showed that women with infertility spend an average of 4 hours a day researching infertility. And it's a lot of time online. It also really matters which one of you has close friends or family who are pregnant or who have babies. That really does matter. Who worries more in your relationship about money? I can tell you in my relationship with my husband, I definitively worry much more about money. I lie awake and worry about money, and he snores. And the last is, who's more comfortable talking about their feelings? And again, I don't mean to be sexist or politically incorrect or whatever, but women are more used to talking about their feelings. And as I said, during infertility, a lot of men feel like they have to hide their feelings to be strong for their partner. Next slide, please. So how can you cope? And these are the things that I tell the couples that I work with. And I think the number one thing, and if you walk away with one thing from this webinar, it should be this: do not assume that the way you are coping is the right way, and that the way your partner is coping is the wrong way. I can tell you right now, the way you are coping is right for you, and the way your partner is coping is right for them. And do not try. So if you want to talk about it more and that's the way you cope, and your partner is very problem focused, that's the way they need to cope. And the two of you need to really respect the fact that people do cope with crises in different ways, and infertility is a crisis. Don't assume that your feelings are right and theirs are not. So if you're anxious and depressed and they seem to be even keeled, that's how you're feeling versus how they're feeling, and both ways of coping are normal. Don't assume that infertility has the same meaning for each of you. I mean, there are a lot of times when a couple starts trying to get pregnant and one person really, really wants to get pregnant with a baby and the other person doesn't really feel quite ready, but they're going along with it because that's what their partner wants. And so if you then have infertility, the ambivalent partner might not have the same intensity of grief or pain than the person who really wanted a baby yesterday. So really don't assume that both of you feel the same urgency. You know, the biological clock, there is a biological clock for both men and women, but it ticks a little faster for women. And I think women have grown up knowing about the biological clock. And it's only within the last 5 to 10 years that we start to see that there is a biological clock for men. It's just a lot more subtle. And in terms of disclosure, you know, a lot of couples don't feel comfortable telling anybody because infertility kind of has to do with sex and things like that. It worries me if one person wants to disclose and the other person does not, because it puts a lot of pressure on the person who really wants to talk. You know, she may want to talk to her mom or her sisters or her friends. And what you often see in couples where it's male factor, the wife wants to talk about it because it's so hard and he feels such shame or guilt about it being a male factor. He doesn't want anyone to know. And we did a study maybe 10 years ago that showed that 57% of women going through infertility haven't even told their moms. And, you know, when my mom was alive, I can't imagine keeping anything from her. So I can imagine how hard it must be for women if their partner doesn't want them to tell anybody. Because, you know, I don't remember if it's a Chinese expression that a burden shared is halved. And, you know, a lot of us are used to when we have a crisis, we reach out to our friends and family. And if you're in an infertility crisis and you can't reach out to friends and family, that can be really hard. Next slide, please. So most people who get married or are in a partnership don't really know how to communicate. And it's a skill. You know, I have 2 daughters in their 20s. And so I'm always talking to them about, you know, the effort one has to put into a relationship, and you need to learn how to talk to each other about difficult, challenging feelings. And, you know, you kind of feel sorry for kids whose parents are shrink. So what I actually have all my couple patients do is to schedule time every day to actually not just talk to each other, but to hear each other. And that's a different thing. So it's called paired listening. And so what I tell them is just every evening, just set aside, you know, 15 minutes, no TV, no phones, nothing on, put the phone in a different room. And you each get 5 or 10 minutes to talk while the other person just listens to you. Then they get the same amount of time while you just listen to them. And then you have a few minutes discussing it, and then no more infertility talk for the rest of the day. And so that the person who wants to talk knows that they are going to be heard every day. And the person who doesn't really want to talk about it a lot knows it's a time-limited entity. Next slide, please. So one thing that I also talk to couples about, and I think this is a hard thing to realize, is no matter how much your partner loves you, they can't read your mind. And no matter how much you love your partner, you can't read their mind. And so the very first thing you need to do is to think really carefully about what your needs are. And, you know, all of us have lots of different kinds of needs. And it's really important when you think about what your needs are to think about which of your needs your partner is capable of meeting. And, you know, I'm seeing a couple right now, and I keep on saying to them, you have to, when you talk about your unmet needs, you need to recognize can't versus won't. Is it that your partner cannot meet a specific need, or is it that your partner won't meet a specific need? And sometimes you have to be really clear and actually write it out. Like, I need a hug every day. I need you to bring flowers once a week. I need, you know, you need to, you know, your partner can't read your mind. And if you can't figure out what your own needs are, how do you expect your partner to know what your needs are. And then whatever needs your partner can't meet, who can meet your other needs? Your family, your friends, your coworkers, your clergy, your neighbors. And maybe there are a lot of your needs that you can meet yourself. If you really like flowers and your partner just can't pull it together to get you flowers, whenever you go grocery shopping, get yourself flowers. Get a $5 bunch of tulips. And there are times where it's okay to meet your own needs. Next slide, please. So the hardest thing to do when you're in a couple, and I remember when I was in grad school, I had never been in a really great relationship. I'd had boyfriends, but just none of them were like, we didn't think about marriage. Anyway, and one of my roommates was in a very, very serious relationship, and she ended up marrying the guy. And she told me once that a relationship takes work every single day. And I remember thinking, well, that's exhausting. But the fact is you do need to think about your partner, and you need to be thinking about things from their perspective. And so there's an expression my old boss taught me that says, do not judge somebody until you've walked a mile in their shoes. And it's true. I think when you're upset with someone, you need to take a step back and think, okay, where are they coming from? Again, if you're in a male-female couple and it's a male factor, even though you yourself might be getting most of the treatment and having to do the most, you need to think about what this is like for your partner's perspective and how much guilt and shame they might feel that you have to have shots every day because of the male factor, and vice versa. So try very hard not to just think of things like in terms of where you're coming from, but try to take a step back and think of so where they're coming from. So how you're thinking and feeling. You may be feeling anxious and depressed and lonely and irritable and really angry about all this, but how are they feeling? Are they feeling the same emotions? I suspect they're feeling more emotions than you would expect. Do they have triggers that you don't know about? And and do you have triggers that you haven't told your partner? All of us have triggers from our childhood. Think about what your triggers are, communicate to each other and say, you know what? When you say this, that triggers something in me, and then you can talk about it. And as I said, understanding things from their perspective is so important. And it's hard to do, but you need to really try to put yourself in their shoes. Next slide, please. I could swear there are more slides, but I guess not. So as I told you, I tend to judge my talks by questions. And I believe you have to put them, I'm sorry, Monica, is it in the Q&A box or the chat box or the raise your hand box?
Yes, so it is in the Q&A box, and I do see that a couple of questions have started to come in. It is the two little dialogue icons at the bottom, or if you're viewing on mobile, they should be near the bottom also. So one of our first questions here is how. So I would like to seek out a fertility specialist, and how should I bring those fertility issues to my partner?
Two really, really good questions in terms of how do you find an infertility specialist? Monica can tell you that, the Inception Network has clinics all over the US and Canada. You could probably, the easiest, you can go to, what's our website? Is it prelude.com? What's our web? I don't even know what our website is. I'm sorry.
Prelude Network. I will place it on the Q&A so everyone can view it on there.
So, when we talk about seeing a fertility specialist, you have to remember that to be board certified in infertility treatment, someone has to, it's called an REI, a reproductive endocrinologist in infertility. And there are only about 1,000, or maybe a little more than 1,000 REIs in the country. And I believe it's really important that if you have a fertility issue, and if you're under 35, if you've been trying for at least a year unsuccessfully, and if you're over 35, you've been trying for 6 months unsuccessfully, to be very honest, I wouldn't spend a lot of time with your OBGYN because time is not on anyone's side. And so I would, either look at the website that Monica's putting up. And if there isn't, because I know all the Prelude doctors and I think they're amazing. But anyway, if there's not a Prelude clinic in your area, you can go to asrm.org. It's the American Society of Reproductive Medicine.org. And they actually list REIs per state. And again, anybody can call themselves an infertility specialist. An orthopedist can call themselves an infertility specialist. a gastroenterologist can call themselves an infertility specialist. So don't be fooled by someone who specializes in infertility. They have to be an REI. It's really worth it because they have this special training. They do an OBGYN residency and then a 3-year REI fellowship. And so they're really good at this. And as I said, you want to move quickly. You wanted to have a baby yesterday, so you want to move quickly. And the second part of that question was, how do I convince my partner?
Or how do I bring it up to my partner? How do I start that conversation with them?
Well, you can say you talked to me. And, basically you could just say you just looked it up. And, the definition of infertility, as I said, if you're under 35 and you've been trying, if you've been having unprotected sex for a year, and it doesn't mean trying has no meaning to me. If you're having sex regularly, at least a couple times a week, and you've been doing that for a year, even if you haven't been quote unquote trying, 85% of couples who don't use birth control get pregnant within that year. And so if you haven't gotten pregnant, if you're under 35, you meet the definition of infertility. If you're over 35, it's 6 months. And the best pregnancy rates one gets from infertility treatment are in people who have been trying the least amount of time. And as I said, I've seen a lot of patients who came in and said to their physician, oh yeah, we've been trying for a year. And so in the physician's mind, okay, they've been trying for a year. But I ask them, when was the last time you used birth control? And they might say, oh, we've been married 5 years. I've never used birth control. So in fact, they really have a 5-year history of infertility, not a 1-year history of infertility. And if you look at the data, the more time you've been trying without birth control, the less likely treatment's going to work for you. And so you can tell this to your partner, the sooner you see a physician, ideally an REI, the more likely you're going to get pregnant quickly. Hope that makes sense. Does that make sense?
Yes, it does. And you actually answered one of our other questions that said, when should we seek help? They mentioned that they're just wanting to know when the right time to seek help was. So you answered that question too.
Well, there are a couple, so for example, if it's a heterosexual couple and the female member, if you've had endometriosis or you have irregular periods or you've had a ruptured appendix or anything that you think might impact your fertility, do not wait a year. Especially if you don't get a period, you need to see an infertility specialist. If you have irregular cycles, you need to see an infertility specialist. And again, if you have unexplained abdominal pain, which might be suggestive of endometriosis, then don't wait the full year. You want to see someone quickly. And for men, if you have a history of undescended testicles, if you've ever taken steroids, if you've had the mumps as an adult, again, don't wait the year. Just check yourself out. The sooner you do it, the sooner you can have a baby.
And
oh, there you go.
And how can we effectively communicate our concerns with each other if one person consistently, wants to talk while the other does not? Or should conversations just be left alone at that point?
Infertility is really hard to talk about. It really is, because, people sort of grow up assuming they're going to be fertile. You never think it's going to happen to you. Probably your friends are getting pregnant and your neighbors are getting pregnant and your siblings are getting pregnant and your coworkers are getting pregnant. And so you just sort of feel very isolated. And as I said, there are almost always going to be huge differences between the two members of the couple. I have found that paired listening works, and it may simply be that one person wants to talk and the other one doesn't want to talk. If that's the case, then the first person talks and the other person just listens for 5 or 10 minutes. If your partner flatly refuses to talk about this, I would say probably try to find a therapist who specializes in reproductive medicine. I think there are 700 of us in the US. And you can actually find a mental health, a mental health professional who specializes in fertility and pregnancy loss. Again, if you go to asrm.org, there is this subgroup called the Mental Health Professional Group. And in fact, someone actually called me today from Texas, because even though I live in Boston, I'm listed as my office in Texas to see if I could see her as a patient, and I can only see people who are physically in Massachusetts. But if you live anywhere else in the country, you can almost always find somebody in your state. And there's an entity called Psych Pact which is, I think there are now 39 states, not Massachusetts, where a psychologist, for example, might be licensed in Florida, but can actually see patients via Zoom or remotely, I think in 39 different states. And so you don't have to find somebody who's in your state. It can be anybody. And you can easily, if you just Google PsychPact, it's PsychPact, it'll actually list all the states that belong to PsychPact. So it's really easy to find somebody. And as I said, you can just look at the asrm.org mental health professional group. That was a very long answer.
Next question is, how do you recommend dealing with other friends and family around you all getting pregnant and both you and your spouse feel worse?
So this is the hardest thing I think about infertility is when other people get pregnant. And I remember early in my career, early in my career, when I started seeing patients, and I knew that women have just this really, really hard time with pregnancy announcements and other people's pregnancies, and just can't be around, not everybody, obviously, but a lot of women going through infertility are very sensitive to people who are, pregnancy announcements, birth announcements, bump announcements, gender reveals, all that stuff. And men don't tend to be as sensitive to other people's pregnancies. And I remember talking to Diane Clapp, who was then the medical advisor to Resolve. And she goes, well, it's very obvious, women get pregnant. And so they are very aware that they are not pregnant, but other people are. Men are wired that other people get pregnant. And so they not getting pregnant doesn't tend to be as painful. And, generally, I've probably seen a handful of couples where the man was also very, very sensitive to other people getting pregnant. But in general, women tend to be much, much more sensitive. And so if you are listening to this as a couple, you need to understand that it's very normal for women to be very sensitive and for men just, I have patients tell me all the time that they're invited to parties. And, when you go through infertility because you really don't want to be around pregnant women or people with kids or et cetera, a lot of couples tend to isolate themselves. And so they'll get invited to a party and the husband's like, let's go. This will be so great. We'll see all our friends. We'll have a few beers. We'll have barbecue. And the wife might say, well, you know what? I think she's pregnant because we went out a few weeks ago and she wasn't drinking. And I think this party is going to be a pregnancy announcement party. And I can't handle that. Then they fight because he really wants to go to the party and he doesn't really care that much. There's a pregnancy announcement and she doesn't want to expose herself to that kind of pain. And I'd say in that case, let him go to the party. Or, social media these days, it's hard to escape this. But I'm also a big believer in being self-protective. I don't want my patients going to baby showers or baby reveals or first birthday parties. I just think it's just too hard to do that.
And our kind of in tune with that is, could you speak a little about miscarriages? For our viewer, they recently had a miscarriage in June and once in January. So it has been very difficult for them. So if you can speak about that a little bit.
You know what, I'll talk about it for a few minutes, but I did a webinar on pregnancy loss a few months ago. And I actually don't know how people can access old webinars. Can people access old webinars?
I can go ahead and I believe in our hub. So yes, we can always share that information on there. And if not, I'm happy to share the link on here too.
Yeah, so I did a webinar, I don't know, a few months ago, I think, on pregnancy loss. So, I've actually done a lot of research on pregnancy loss and the psychological impact. I myself have had a miscarriage. And I remember when I had my miscarriage, I remember thinking, I've counseled hundreds of people who've gone through a miscarriage. And I think until you have one, you just don't know how hard it can be. And the first thing to remember if you have a loss is you have to acknowledge that for you and your partner, this is a death. And this is something that needs to be mourned and grieved in the way that you need to mourn and grieve. And our society is so uncomfortable with miscarriage they tell you not to tell anyone you're pregnant till 12 weeks in case you miscarry. And I'm a believer that, that thinks if you have a miscarriage, you want people to be there for you. And my sister had the same experience. She had a miscarriage, and she told everyone that she did a miscarriage. And she said that, people came out of the woodwork, that they had also had a pregnancy loss. And so she got to talk to people who had been through it. And I found the same thing. In fact, when I had my miscarriage, one of my best friends told me that she had had a second trimester loss before I met her, and I never knew. And she didn't talk about it because she just felt uncomfortable with it. But it's really hard. There's a lot of resources out there. As I said, I did a webinar not that long ago. Resolve and ASRM both have resources. And, I truly think that if you have had 2 losses in 6 months, that if you can do this, I think talking to somebody about it could be really helpful, because it's very hard to sort of put yourself out there and get the kind of support you need and to process. And I think also after 2 miscarriages, people tend to be really anxious about getting pregnant. And so, in fact, we are hopefully this year, that's my goal, we're launching a new center of excellence in all of our clinics for women who've had 2 or more pregnancy losses. And I will be training physicians and nurses and the front desk people. So people who don't have infertility, but have had at least 2 losses, need support, and they need expertise, and we need to understand why they had those 2 miscarriages to see if we can prevent another one from happening so that your 3rd pregnancy ends up with a baby.
And I am adding those links on the resources section. I'm adding them on the resource page. So on the icon, it will be on there. We have the Prelude, we have ASRM and Resolve there as links for you to seek as sources. And they are in the resources icon at the bottom near the Q&A. And another question that we have is, how should I approach my partner about the cost of treatment?
This came out in this podcast I did yesterday, because we started talking about money. And I said, I remember in graduate school learning the top 3 things that couples fight about are money, sex, and kids. That's infertility. Infertility is money, sex, and kids. And, and the fact is that infertility treatment is very expensive, that most states don't have mandates. A lot of companies now are covering infertility. And so if you do not have a state mandate and either one of you is employed, check out what's going on in HR. I mean, a lot of companies don't advertise that they cover infertility treatment because it's expensive. But if you actually read through what benefits might be covered, you might find that your company actually does offer coverage, either independently or through one of these third parties like Progeny or Carrot. Or ARC. There are a bunch of places that offer treatment coverage through your employer. There are ways, if you meet certain income requirements, that some clinics will give you a discounted rate. If you meet certain income requirements, the pharmaceutical companies, the big 3, Ferring, EMD, Cereno, and Organon, can give you significant discount on your meds. I believe there's a phone number for each of them. If you look up the 3, that if you are below a certain income level, you get heavily discounted medication. So there are ways to make it less expensive. In terms of you and your partner, it's so hard to talk about big chunks of money. And if you have no coverage whatsoever, we are talking big chunks of money. I'm a believer in asking family members if they can help or if they're willing to help. There are companies that actually have loans you can do. And I know the Inception, with all its different families of different things, offers, bundle with meds in ways that you can spend one amount of money and then you get your money back if you don't get pregnant. So it's a way to sort of guarantee you'll either have a baby or get your money back. And a lot of places are doing it. But there are ways. There are now some entities that are going to be giving away free cycles. So I can't say anything right now, but keep your eyes out, because in a couple months, we're going to have good news to share.
Thank you. And next question that we have here is how to cope or fix low sex drive since starting fertility treatments.
That's a good question. So I have probably seen 5 patients in my entire career who have said that infertility has not affected their sex life. In fact, infertility almost always affects your sex life because spontaneity goes out the window. Because you're probably told have sex every other day mid-cycle, and that's not very romantic, and it's not intimate, and it's not spontaneous. And both of you start to associate sex with failure, and the man might feel like the only reason she's willing to have sex with him is to get sperm from him, none of which is romantic or fun. Men tend to express their affection physically a little bit more than women do, and so to have one's sex life suffer can be really hard. If you happen to have a guest room or an extra bedroom in your apartment or house, maybe have one bed be for baby making sex, which is mid-cycle, and have another bed be for fun sex. There also are, therapists who specialize in fertility who are also sex therapists. I've seen a lot of patients where sex is an issue, and there are lots of ways to improve one's sex life.
Okay, next question that we have is, do those resources included in any support groups, or where can we find something like that? Any support groups?
So Resolve offers support groups. I believe they're mostly virtual across the country. I'm a huge believer in support groups. I created the Mind Body Program for Infertility probably before any of you were born. It was in 1987. And I was obviously a huge believer in the Mind Body Program. And I got a grant for the National Institute of Mental Health to actually compare the Mind Body group to support groups to routine care. And so, because I'm the most biased person in the world towards mind body, we're trying to figure out how to actually do a good research study. So we actually hired this woman, Diane Clapp, who created the support groups for Resolve. I trained her how to run mind body groups, and she trained me how to run support groups. And we took turns running groups for this research study. And I went into this thinking, oh my God, mind body groups are so much better than support groups, and they're so much more effective. And there's so much, let me tell you, these support groups were great. And if you actually looked at the pregnancy rates in this study, the mind body patients had a 55% take-home baby rate. The support groups had a 54% take-home baby rate, and the control group had a 22% take-home baby rate. So in terms of pregnancy from that one study, I can tell you that doing a support group is associated with an increased pregnancy rate that's equivalent to the mind body group. The mind body patients did better psychologically than the support group, but their pregnancy rates were the same. I'm a big believer in support groups. So I would go to resolve.org. And, again, now that so many things are remote, I have trained people all over the world how to run mind body groups. So obviously I like mind body groups better because it's not just talking about your infertility, it's actually giving you skills. It's just harder to find mind body groups these days than it is to find support groups. But if you can find a mind body group in your area, definitely enroll.
Okay. Next question that we have is, what do you recommend for couples where there are different levels of risk acceptance while going through treatments, such as avoiding alcohol or social outings where illnesses could spread?
It's a really good question. I'm actually doing a webinar. I couldn't tell you when, in the next 2 months, on lifestyle behaviors. And this is a source of enormous frustration for people, because what you tend to see in most couples is that women make very significant changes in their lifestyle habits, and they're told to stop drinking alcohol and decrease the amount of caffeine and not exercise vigorously, but not be a couch potato, and avoid cigarettes at all costs and blah, blah. So women tend to make changes in their lifestyle habits. Men tend to be a little more hesitant, although I've actually seen couples where the man made a lot of changes and the wife wouldn't make changes. So I don't want to say it's always about the men. It is really important if you have a lifestyle habit which could impact your fertility. And the reason I say this, that I think you really need to look at this, both of you need to look at this, because lifestyle, all the things that affect female fertility also affect male fertility. And when I talk to patients, and the biggest thing I talk to them about is exercise, and I'm not going to go into this huge debate about exercise tonight because I'm going to do it when I do the webinar in next month or the month after. But what I don't want to see happen is that you don't change your lifestyle habits now, and fast forward 5 years, you regret that you didn't do it. And if you have a lifestyle habit, for example, like very vigorous exercise or smoking cigarettes or anything that probably will impact your fertility, if you make that change, your increase in fertility will happen very quickly. For men, it takes 2 or 3 months because sperm production takes 2 or 3 months. But, I've seen patients dial back on their exercise regime and they get pregnant the next month. So if you're going to make a change, you're going to see a result quickly if that lifestyle habit was in fact impacting your fertility. And I tell my patients, you don't have to change this forever. Just change it until you get pregnant and have a baby. And then you can do whatever you want to do. You can eat what you want, you can smoke what you want. Well, don't smoke around a baby. And both of you need to be committed to that, because it's very hard to be in a healthy relationship if you are blaming your partner for not making a change that could give you a baby.
And next question is, you mentioned that companies may be offering free cycles soon. How can I find out about that and be notified when this goes into effect? Is there a mailing list I can subscribe to?
I can't talk about it for a couple months. I would just say, and Monica could probably answer the question, is keep monitoring any communication from inception.
So we do have, of course, you probably received emails about our sessions with Dr. Domar, of course. So please keep a lookout for those as soon as we are able to share any information. We are excited to share any information. Our Inception, so just to give you a little bit of a background, Inception is our parent company, and it was started by an actual patient of fertility. So it is very near and dear to us. And within the Prelude Network, it is our network of clinics. So we understand to an extent definitely what you're going through. So as soon as we can share more information, we will, and you'll be able to get that through our mailing list. And once Dr. Domar is able to share that information, I'm sure we will have a session to give you more information too. And the next question that we have here is, could you talk a little bit more about parents within the age group of 40 and over wanting to have a baby?
So if you're 40 or over, ideally 40 to 45, because I worked at Boston IVF for 20 years, and I was the one that really pushed to have age cutoffs at 50 for people, because I think after that, it's really tough on kids. But if you're 40 to 50 and you want to have a baby, what they say actually is, remember I said you should try for a year if you're under 35, and for 6 months if you're over 35. If you're 40 or over, and after you've tried for 3 months, you should see an infertility specialist, an REI, because the odds of getting pregnant on your own are much lower than your odds of getting pregnant with something like IVF. And, obviously age is not your friend, but I can tell you, I actually looked at this data not that long ago. The pregnancy rates of women 40 to 42 or 43, especially if they do PGT, which is the genetic testing, is actually not bad. And Jamie Griffo is our medical director, and his title's not medical director. It's like, I don't know, president of medicine or something. Anyway, I'm pretty sure he published a paper showing that if a woman over 40 produces a genetically normal embryo, her chances of having a baby are the same as women who are younger. So I would not discourage you if you're over 40. You should certainly see an infertility doctor and get a basic workup, and they can then tell you what your chances are for getting pregnant. But I would do it tomorrow.
Okay, and could you please share how we can participate in the study with the miscarriage back-to-back?
Oh, sorry, it's not a study. It's going to be centers of excellence. I had this idea because I had a patient who got pregnant really easily, and had 2 miscarriages. And, she doesn't consider herself an infertility patient because she gets pregnant through sex, which is just an amazing concept to me. And yet her grief was real, and she really was an infertility patient. And so I came to our executive team and I said, I really want us to become centers of excellence for women who don't have infertility per se, which means they get pregnant through sex, but then they've had 2 miscarriages. And, you can obviously go to any of our clinics right now, because once you've had 2 miscarriages, your insurance company will cover a workup, see if we can figure out why. But I want all of our clinics to have a special expertise in women who have had 2 miscarriages, not from infertility treatment, just so your physician knows a little bit more about how really awful miscarriages can be, and so that your nurse knows and the women at the front desk know, just so that we can offer, I'm the chief compassion officer, and I have tremendous compassion for people who've had losses. And I just want everybody in our network to be ready to offer a little extra TLC.
Great. And I will be also, so we do have a couple of studies that on our website. So I am sharing the fertilitystudies.com website there. I am sure that, can you actually talk a little bit more about a couple of the studies that we do have going on that potentially are needing people if they're interested?
Yeah, we have 4 or 5 studies right now where we're actually actively recruiting patients. And then we have another 5 or 6 that we're going to launch in the next couple months, some of which actually involve free cycles or compensation. I think one study we're looking at a different form, a delivery form of progesterone. So definitely look at that site. The 2 studies that I'm most involved with right now, and we're going to be launching more this year, is the first one is called the Auto study. And that one, I want to know whether or not stress impacts IVF outcome, because that's been the question I've been asked my entire career. Does stress impact IVF outcome? And asking people if they're stressed doesn't really give you an accurate assessment of their stress level, because people perceive stress differently. So the Auto company makes this little device. It's like a little circular device that you wear on a belt for like 3 minutes in the morning. And so we are recruiting 240 women who are about to start their first IVF cycle. And it has to be at a Prelude clinic. And they wear the belt for like a week before they start their stims, for the whole 2 weeks of their stims. And again, you just wear the belt for like 2 minutes in the morning, and then during their embryo transfer cycle. And I think you get paid, I want to say $400 for doing it. And then you actually get to keep the device after you finish your first frozen embryo transfer cycle. And you actually get an app that gives you instantaneous feedback in terms of your stress level, so that you can, and it gives you suggestions on things that you can do to reduce your physiological stress, mostly your heart, your cardiovascular system, and your central nervous system. And we actually have collected data now on 100 and something patients, and the data is really interesting. I can't tell you what it is because I haven't presented it yet. But if you are going to be doing an IVF cycle at one of the Prelude clinics, I would love it if you would look into the Auto study. And then the other study that we're doing that I'm involved with is, there's been a ton of research coming out of Europe for the last 10 years on patients wanting patient-centered care. And the fact is, though, that what we think people consider patient-centered care may not be what patients think of as patient-centered care. And so in Europe, they've done all these, beautiful studies where what they've changed in terms of patient-centered care don't really make sense to me. So I got a grant from EMD Serono, which is one of the pharma companies. And so we sent out surveys to our patients to say, what do you think is patient-centered care? What's the most important for you in terms of how your doctor communicates with you, how the financial person communicates with you, what the clinic looks like, how the nurses treat you? I am not going to presume to say I know what infertility patients want. And so we wanted to find out what patients want. And so we just got the data. We have data on 1,500 patients. So actually now we do know what patients want. And we are also having our physicians fill out the survey as, what do you think your patients want? Because I am going to guess right now that anybody working with infertility patients probably thinks they know what patients want, but I'm not sure that we know what patients want. And so this is why we're doing this study. And in fact, EMD just asked if they could enlarge the study and include nurses, which we're going to talk about tomorrow at a meeting. But, again, I'm presenting this data at the end of March. And the data is really good because it tells us exactly how patients want to be cared for. And so we can change the way we care for patients to really meet the needs of our patients right now.
And I think we are wrapping it up with our last question here. And what are some of the ways to help my husband come to with the possibility of maybe or maybe not being able to have a child?
There are male therapists out there. And I honestly think, male therapists who specialize in infertility, and there's this amazing guy he's in Baltimore. And so I don't know if Maryland is a site backstage. His name is Bill Petok, Petok. And he has a practice. And he mostly works with men who are part of a couple with infertility. I don't know how to say this without sounding really crude, but I had a patient years ago that I was seeing, and she was a cancer survivor. And she had done a bunch of IVF cycles, but it was pretty clear that the chemo had affected her egg quality. And she was 35 years old, and she just wanted to stop doing treatment, and she wanted to adopt. She was absolutely fine with adoption. She had an agency she liked, and her husband, we talked about this, and they've given me permission to talk about them. And he said to her, and I still can't believe this, he goes, well, you're 35 years old. He says, let's just try for 5 more years. And if you're 40 and we're not pregnant, we can talk about adoption. Because he couldn't believe that he couldn't get his wife pregnant. No matter what the doctor said to him, and he was seeing some great doctors, he just couldn't believe that because he had spent a chunk of his adult life trying not to get someone pregnant, he couldn't believe that he couldn't get someone pregnant. And I think it's just a really hard thing. And by the way, they adopted the next year, I think, and they actually live in my town, so I got to see the baby grow up, which was really fun. I think it's just hard for men to believe that they need to see a doctor and that they need help. But, if you look these days at the pregnancy rates from treatment, it's extraordinary. And so, no matter who you are or what you are, no one can promise that you're going to get pregnant. But when I got into the field, about 5% of people got pregnant through IVF per cycle. And now it's like close to 60%. So the odds have gotten so much better. It's really worth giving it a shot.
Absolutely. And I think with that, we will be wrapping up. Is there any last minute things you would like to mention, Dr. Omar?
Infertility is a tough journey. I published a paper, 25 years ago, that showed that women with infertility had the same level of anxiety and depression as did women who had cancer, AIDS, or heart disease. And, it was a small study, and I published it, and people keep on referencing it because it makes someone who's going through infertility, who's feeling pretty distraught, it makes you feel normal. And, I've been working with infertility patients since 1987. And so, at least once a week, I'll say, well, I've seen it all. I think I've seen it all. And then something happens. I'm like, okay, I haven't seen it all. But infertility is really hard. My parents went through it. It took them 7 years to have my sister and 5 more to have me. So that clearly has influenced my career choice. It's hard to go through. But there are so many resources out there. If you are seeing an infertility specialist, ask them who they recommend to support you. The nurses in these clinics have so many great ideas on things that you can do to help yourself feel better. There's a lot out there. And, if you happen to know somebody else with infertility, sometimes it's really good to talk to somebody who knows exactly how you feel. And so just please don't give up hope. Treatment has a really good chance of giving you, fulfilling your dreams, and just ask for help, get support so that you can get there.
Great. Thank you. Thank you, Dr. Omer. I think that with that, we will go ahead and end today's session. So thank you all for attending this event. And thank you, of course, Dr. Domar, for joining us tonight. We hope that you all found this session helpful. You will receive a recording of the virtual event of tonight's recording that you may view as a refresher at any time. And of course, please be on the lookout for our next month's event. I believe that one will be about lifestyle. And
let me look at what it is, because hold on, well, you keep on talking. I know it's in March.
yes, and we will be sending out the email, and I do believe that it's the lifestyle one. And if you have any
Yes, sorry.
topics,
March 13th, it'll be 9 p.m. Eastern Standard Time, and it's on lifestyle habits. And I will present all the latest research on the impact of different lifestyle habits for both men and women.
yes, so we will go ahead and share that with you all. And of course, if you have any topics that you would love for us to discuss, you can use the Q&A feature on there and put that in there. I'll actually, next time I will make a poll. I'll keep that note on my brain right now to allow you to go ahead and submit any topics that you would like to hear more about, or any possible resources that you would find interesting and want to learn more about. So
yeah, we definitely need more topic ideas. I think we only have filled webinars for the first half of 2024. So we definitely need topic ideas for the rest of the year.
Absolutely. And we want to hear from you as patients or potential patients, of course. So you are definitely people that we want feedback from. So I will make a note to have that poll next time on March 13th. And with that,
thanks, Monica. I really appreciate your hosting for me tonight, because you know I'm not capable or competent to do it myself.
Oh, no. Thank you. I'm happy to be here, and of course, happy to help any way that I can. So thank you so
Good night,
much,
everybody. Happy Valentine's Day.
Yes. Bye.
Bye.